Hi, it's Dr. DeCubellis with Main Street Chiropractic. Today I am at Gantos Dental Group with Dr. Gantos in downtown Naperville. And we want to talk a little bit about her practice today. So first, thanks for having me out here today.
Thanks for coming.
So tell me a little bit about how you started your practice and tell me about what your practice is all about.
Yeah, so our practice has actually been a dental group in Naperville for over 25 years. So after my dental training, I'm originally from Naperville, I did my residency program and I came back, and it just worked out really well that the dentist was looking to retire at that time, and we clicked really well. We had very similar ideas about quality and patient care and things like that. And so we transitioned at that point. And then in July of 2019, we built a new office, and we moved here at that time. But our practice really focuses on quality patient care. We provide comprehensive dental services, so we're able to provide all different types of services under one roof for patients of all ages. And we really pride ourselves on personalizing the dental care. So rather than kind of having a, one size fits all sort of mentality, we really look at people's individuals and what their risk factors are, and really try and custom tailor prevention plans and treatment plans and things like that to the actual individual themselves.
That makes sense. Now, when we talk about dental, I know there's a couple of questions that people always kind of have, so I want to kind of go over those with you.
Yeah.
So first is, let's just get real general, why is tooth health even important?
Yeah, absolutely. So with dentistry, of course, we're looking at tooth health, we're looking at gum health, we're looking at jaw joint health. Essentially, it's all the head and neck area. So with teeth, of course, they're important because chewing, smiling, people don't realize if you don't have teeth, your nutrition's affected by that, which obviously affects the rest of your oral health. Gum health, there's really strong correlations between cardiovascular health, diabetes, dementia, Alzheimer's. So inflammation in the body anywhere is obviously, a problem.
Right.
So oral health plays into a larger, bigger picture, more so than oftentimes I think people give it credit for.
That makes sense too. And with that, the reason checkups are so important is I'm assuming that the sooner you find something, the easier it is to take care of, instead of letting it go on for long periods. So that's why checkups are so important, correct?
Yeah, so kind of one of my favorite ways of thinking about it is, it's harder to diagnose early, easier to treat, easier to diagnose late, harder to treat, right? So if we wait till there's a lot of destruction in somebody's gums and bones or in their teeth, well, now that turns into a much bigger, more difficult problem to try and arrest, versus if we're just really proactive about, checking things regularly and making sure that we have good prevention plans in place, then it's a lot easier to intervene, and it's typically smaller, more manageable types of issues and problems. Additionally, with dentistry too, there's a lot of things where, certain things can be subjective. So with cavities, it's not sort of like, okay, somebody has a cavity, you've got to start drilling their tooth. Sometimes, depending on the size of the cavity, the location of the cavity, the rest of their oral health, you can try and remineralize the cavity or use really high quality products and things to get the enamel to try and repair itself. So that's one of the reasons we take, serial radiographs to see, are things progressing, are they staying the same? So there's a lot of artistry and sort of even just clinical experience that goes into caring for people, and that's why you really do have to customize it to the individual, because your risk factors may be different from my risk factors, and how you have to approach somebody's healthcare really has to be for that individual and their needs.
And that makes a lot of sense too. I mean, you have to look at each person individually, because they're going to be eating different foods and they're going to be doing different things to where they might have more risk factors.
Their genetic makeup's different, yeah, their home care is different. There's people who brush and floss and do everything textbook perfect, and they still, have issues with gum disease and things like that. And it's okay, well, how do we modify then the factors that we can modify? I think as dentists, we've done a really good job of scaring everybody into, if you brush and floss twice a day, every day, that you'll be perfect. And we know that obviously that's not the case. There's other things that go into it. It's a biofilm in your mouth, and you don't get to pick what bacteria predominate in that biofilm, right? But we can use quality products or treatments or technologies to try and maybe alter that biofilm and make it a more favorable type of environment.
Right. Now, and one thing too is in dentistry, just like any other kind of medical profession, there's always going to be changes over the years with different technology research that comes out. So one thing that is kind of interesting that I've seen is that over the years, the type of material used in fillings has kind of changed.
Yeah.
So we've seen gold, we've seen silver, we've seen porcelain. Can you kind of tell me like what's the difference between these and why has there been a change?
Yeah, definitely. So different dental materials have different physical properties to them, obviously, and things that are advantageous and disadvantageous. So with gold wears most similarly to enamel. So gold is really nice in that if we use it to restore a tooth, we're not causing opposing wear on the other tooth that it's chewing into, right? Versus other types of materials. But the price of gold and the look of gold is one of the things that really keeps people from wanting to do that. People don't want gold in their mouth. They want things to look really pretty and nice and natural. Between sort of silver fillings and tooth colored fillings and porcelain and things like that, a lot of the older types of materials that we had were a cohesive type fit, meaning a lot of it is friction fit. So to get something to fit frictionally as a dentist, we have to be more aggressive in how much tooth structure we remove, because maybe we need a box or a groove, or we need to prepare things in ways that we can sort of lock a material on there, versus now we try and do things, or at least I do, and I think a lot of people try to, minimally conservative, and we adhere stuff so we can actually make a chemical bond between enamel and porcelain, or enamel and a resin material. And when we do that, we don't have to take away unnecessary tooth structure, because we don't want to do that. You can't grow your enamel back. When we remove any enamel, you're never getting that tissue back, right? It's like microsurgery on your tooth. So it allows us the ability to not only restore a tooth in a way that looks really beautiful, but also really conservative. So we're not, causing people to need root canals, or we're not causing bigger issues, because ultimately any type of dentistry in your mouth, nothing lasts forever. So when you start restoring a tooth, you start that cycle of small fillings can become medium fillings over time, larger fillings. So the smaller and the more conservative you can be, and the more you can use adhesive dentistry for really good seal and bond, in my opinion, the better.
That makes sense too. Well, I mean, even when you look at the body as a whole, it's going to break down. So, when you talk about a filling and you talk about the tooth is still breaking down as it goes, and so that makes a lot of sense. There's going to be, you want to find something that's going to be able to be adaptive and last as long as potentially possible, but we know it's not going to last forever.
Totally.
Nothing lasts
it's
forever.
a dynamic environment, right? There's fluid, there's saliva, there's bacteria. You use your teeth to literally chew. So obviously, they're under high function and duress. So it's like a car. It's beautiful, but you put enough miles on it, and eventually you got to get a new one. It's the same thing with dental materials, but we certainly try and use technologies and different types of materials and things to make it better. And that's one of actually the kind of fun, exciting things about my field and about dentistry is it's always, okay, we're doing it really good now. How can we be better? What's the cutting research say? What new material are they going to develop? And I think we're starting to see it, and I think we'll see more of it, where these sort of more bioactive materials, where not only are we restoring your tooth, but we're also trying to get your body to lay down new tissue or to kind of regrow and rebuild. And I think, down the road, obviously that will advance even to just stem cells, and we won't be doing fillings. It'll be, okay, well, how do we just get your enamel to repair and build totally new enamel, right? And that's exciting, and that's cool that we do Band-Aids now, but it's really nice to think that we can just get the body to go back to what it should be.
Yeah, thinking of where we could go in the future is just, there's really no limit. So you really got to be on your toes.
Yeah, absolutely. But it is exciting in dentistry,
Mm-hmm.
even just from a technological standpoint, the things we can do. We make crowns in our office, so you don't have to be in a temporary for 2 weeks, or with implant planning and things like that. You can literally digitally do the surgery and have somebody come in and they can, get a new tooth with, really, really easily, which it's cool. It's just nice to be able to integrate all these different types of, whether it's, physical technology or in the dental materials, and just kind of make it a smooth process.
Now, going off of what you just said, take a point there. When we talk about a crown, now is a crown most similar to a filling? Is it different? Can you tell me what a crown really is?
Yeah. So a filling material is made to kind of fill in between sound tooth walls. So one of the most common places people will get cavities is the teeth. I kind of equate it to, how you see a brain, it has like kind of these wrinkles in it, right? the tops of your teeth have that. We call them pits and fissures and grooves, but they have sort of these wrinkles on top, and that's where the bacteria can hide down into. And from physical limitations, your toothbrush doesn't get down in there. These are microscopic little narrow places, right? So it's one of the most common areas people will get a cavity. So that's a really appropriate place for filling. We've still got a really nice sound tooth, but we've got a little, cavitation in the middle of it. We remove that, we put filling in that. So fillings are smaller and they're more conservative. When we put a crown on a tooth, it's 360 around the tooth. So we actually take that tooth, we shrink it down, and it's kind of like a top hat almost goes on the tooth itself. So if there's lots of different patchy fillings in a tooth and we start to undermine the structural integrity of it, or it starts to get fracture lines or things like that, that's where if we just keep putting filling, that tooth's going to crumble apart. So rather than let that happen, we take something and we kind of wrap and splint it all together. So that really sort of rebuilds it back up.
Okay, that makes sense. So it's a more protective type of thing then.
It is, but it's a more aggressive restoration, right? So with the filling, we're keeping it smaller. If we're doing a crown, it's a little bit more aggressive. And then a lot of times people don't know, but there's a lot of stuff in between too. So people are very familiar with the terms fillings and crowns, but there's things like inlays and onlays and veneers and all these different types of partial coverage things where, okay, if we have maybe one good wall of enamel, but we have to replace another, how do we want to do that? Do we want to put a crown on and destroy all that really sound enamel? My treatment philosophy, no, I'd rather do something more conservative. I'd rather rely on the fact that we have really good adhesive technologies and we have really strong materials where I don't want to start drilling tooth structure that I don't need to. So there's a whole kind of spectrum there between filling and crown, also in the middle, and I think sometimes some dentists maybe just kind of stick to either or, but I think sometimes too people maybe don't educate patients a lot about that kind of stuff, that, hey, it's not just filling or crown, we can do partial coverage types of restorations too, and be conservative, so that if 20 years from then we need to do a crown, well, now we can do a crown, versus when you do a crown, what do you have left after that, right?
Right.
So again, the more conservative you can be, especially with our lifespans lasting as long as they do, our dentition really worked well when people died at 50, right? When we didn't have really long lifespans. You had your baby teeth, you had your adult teeth. It would be awesome if we had a set of geriatric teeth, right? It'd be great if you hit 60 and it's like, okay, now you get your next set. We don't have that, but our lifespans keep continuing. So because of that, it's even more important to preserve things and think really long term. You can have great teeth, but if they're only going to last you 40 years, that's a problem in and of itself too, right? So it's always this sort of thought of like, okay, anytime I do anything irreversible to somebody's tooth, is that really the absolute best service and best thing I can do for them to set them up for long-term success, right? I can make anything work short-term for somebody, but long-term, is that going to be what's best? And that's why I am so kind of, passionate about adhesive dentistry and about being, minimally conservative, because you really don't want to over-treat. And it's a lot easier to cut, it's easier to cut a crown. It's easier to have somebody in here and be like, okay, I'm going to take my little drill and I'm just going to go 360 around your tooth and pop something on there. That's kind of mindless, right? If I have to custom design it to, well, what enamel do you have? And, and also there's a lot of education that goes into that. It takes a little bit more skill. It takes a little bit more time, right? But it's worth it, and it's worth it for people to have their teeth really healthy for a really long time.
Right, and it's doing what's best for the patient.
You got it.
Which is the best thing you can do.
Absolutely, absolutely. And we're a very patient-focused practice. We just have really good relationships with our patients, and we take a lot of pride in doing what's right. And that truly is really why I wanted to have my own practice, and that's why I came out of residency and I didn't work for somebody else, because I had very strong convictions in what I think is right and wrong. I didn't want somebody telling me, okay, every time you see, a silver filling, you have to drill it out. Well, but you don't, right? I mean, I understand that, you may want to build insurance every time you see one, and it's a good excuse to do it, but is that really what's best for the patient, right? Or, having, somebody tell me, okay, you have to cut 30 crowns a month. Well, if I don't see 30 teeth that need 30 crowns a month, I don't want to cut 30 crowns a month, right? So I just have very strong ideas of what I think is right and wrong, and I wanted to be able to practice with quality, use good labs, good materials. We don't, a lot of people outsource their dental work, and that's okay, but then you don't know what's in it, right? So all of our dental work, it's an FDA approved lab that comes back. They found lead in dental crowns before that are being outsourced to other countries and things like that. Our crowns come back with a certificate of authenticity of exactly what's in it, and I wanted to be able to provide that level of care. That's what makes me feel good when I'm doing dentistry, and so that's why that was important to me.
That makes sense. Now let's switch gears a little bit. When it comes to the other big issue I think people think of when they think of dentist is their teeth not being straight and needing something to be done about that.
Yeah.
That being said, it seems like, if we go back to the 70s to now, it's changed a lot in different options and the way it's tackled. So talk a little bit about that with me.
Yeah, absolutely. So that's something actually I'm really excited to talk about too, because that's a service that I love providing. So when it comes to tooth straightening, there's two big different options, right? One would be traditional bracket wire braces. Typically we think of that as metal braces, although they do have some that are a little more aesthetic, ceramic, but typically it's metal braces. And then the other avenue is clear aligners. And one of the cool things that a lot of people don't know is clear aligners, the way that technology really got started is a couple college kids who had their braces, had their clear retainers that they're supposed to wear at night to keep your results, forgot to wear it because you're in college, you're not putting your retainers in every night, and then figured out that, hey, when I put my retainer in, it reshifts my teeth back. And that was actually how Invisalign got started. So it wasn't even thought of or conceived by a dentist, which is kind of an interesting little tidbit. But so clear aligner therapy is super duper effective. And the R&D that they've done it, and the technology and just the level of knowledge that's gone into it in the last 20 plus years is incredible. And even just in my practicing lifetime, from when I was first Invisalign certified to now, just the updates in technology and what you're able to accomplish with clear aligners is night and day. It used to be we could do some movements with clear aligners, but not everything. Or maybe we'd start somebody and get them kind of 75% of the way there in clear aligners, and then we get the braces on to fine tune stuff. And we really don't have to do that anymore. The technology has really advanced where we can really tackle pretty much mostly anything with clear aligners, and provide a really well done service and still be able to get the teeth and the bite and everything aligned and in the position and the way that we want it to be, that's best for the patient, in a really aesthetic way, because clear aligners, you really don't see them, in a way that's really easy to still clean your mouth and enjoy the foods that you like. We personally use a company that I think is just terrific. It's called OrthoFX, and they do a really, really, really nice job of taking all of the great stuff that Invisalign does and all of that technology, and then marrying that with all the things that a lot of the other clear aligner companies do. So they provide a really cool patient experience where you actually get an app and you're taking photos, and I can monitor patients even when they're not in the office. So if something gets off track, we can catch it quicker. And they just provide a really, really cool experience that makes me really excited to talk about clear aligners, because we see just how much our patients enjoy it, and we enjoy doing that for people. So there's definitely a lot more options now. The big thing with clear aligners is somebody just has to be compliant. So if you're wanting to do that type of a treatment, we can set you up for success, but at the end of the day, you're the one that's got to put the aligner in your mouth 22 hours a day. They're worn all hours except eating and drinking anything other than water. They're in somebody's mouth. But with OrthoFX and some of their proprietary technology, the teeth move so quickly, people get so excited at seeing the results that I've honestly never had a case where somebody, where it didn't go the way that we wanted it to go, where they weren't excited to wear it and they weren't compliant with it. So that's, a little bit about clear aligners.
Now, let me ask a follow-up question on that. So when it comes to whatever option they want to do, even clear aligners, is there ever a time to where someone's teeth are just so bad it's not even an option, or is there some kind of measuring, or how does that work?
Yeah, good question. So from a treatment standpoint, there are certain things that we look for in ways that we want to treat people, right? So we wouldn't ever start moving teeth on somebody's mouth where the teeth weren't healthy. It's not ethical, but it's also just not a good service for a person, right? So when it comes to treatment and treatment philosophies, we have to make sure we're free of any pain, we're free of any infection, we're free of any active disease. So whether that's cavities or whether that's gum disease, you have to have good gums and bone, right? We're moving the teeth and the gums and bone. If we do that in a compromised system, you can cause more harm than good. And that's really the danger of, there are clear aligner systems that you can do totally dentist free, where people do them from their homes and they mail them in, and that's where they start to get into trouble, is because if you don't have the correct architecture for that, and things are getting moved inappropriately, you can literally move teeth out of gums and out of bones and cause tooth loss and just a myriad of problems, right? So you do have to have a healthy system in place. Now, the one thing that maybe doesn't have to be as healthy is the jaw joints, because sometimes jaw joints and TMD can stem from having a bite that's a little bit off. So sometimes we might not have the perfect jaw joints, but we're moving the teeth so we can get the jaw joints into a more orthopedically stable position, right? So that would be maybe the one thing. But yes, we would want no cavities, no gum disease. Somebody has to have good home care, right? If I don't think somebody can brush and floss their teeth, the last thing I'm gonna do is put those teeth in plastic trays and let them bathe in bacteria. So there are other factors that get taken into consideration for sure.
Okay, so if all that's good though, there's nothing to where it's like this tooth is just so far back, we can't do anything with it, or is there?
I mean, yes and no. You know, there's very minimal that can be tackled, right? Now, can it always be with a clear aligner? No. Sometimes you do need chains. You need to, you know, a very common occurrence in individuals is the eye teeth, or those canine teeth, kind of the cornerstone teeth. Those sometimes actually get kind of turned upside down and sideways and stuck in the roof of the mouth, right? And then we have to make a little window and kind of grab it and pull it with a chain and pull it down. So there are times we need to do that. Can you do that with a clear aligner? Somebody maybe with a lot of skill can. That would be outside of my wheelhouse for sure. But you know, an orthodontist might be able to do that, but typically we do that with brackets and with wires. Or there's things called TADs, which are implants, but not implants to replace teeth. They're kind of little implants to anchor, so we can put wires and we can put pulleys and we can kind of pull things really far. So there are different ways of going about things where pretty much we can kind of move most anything, even if it's really off kilter. It just has to be designed the right way.
Okay, that makes sense. Now, let me ask you this just because I'm curious. So when we have someone who has an issue to where we need to have teeth straightening, right?
Yeah.
Have you noticed there's any kind of either like warning signs or things to where they're more likely to need it, like either like premature wisdom teeth coming in, or they lose a lot of teeth at once? Is there any kind of things where it's like, hey, if this person has this, most likely they're probably going to need some sort of straightening at some point?
Yeah, so with tooth straightening kind of has a funny stigma to it of it's just cosmetic, right? Straight teeth are pretty and that's all they do. And the reality is straight teeth are necessary for a lot of stuff. It's more conducive to good gum health, right? When you've got teeth that are overlapping, very hard to clean, that starts to create gum issues. So it's more conducive to good gum health. It's more conducive to an cavity type of environment, right? If we're cleaning things better, we want a balanced bite. Not only for your TMJs, but also too for the wear on your teeth. If your teeth are hitting in inappropriate ways, then that can cause issues with the gums and the bones and the support system for the teeth, but it can cause issues in the teeth. The teeth can get upset. The nerves can get upset. We get unusual wear. We're wearing things down that shouldn't be worn down. We're getting, funny kinds of pains in people's mouths or headaches and things like that. So we certainly see signs like that. One of the other big ones that people aren't really educated about is one of the primary functions of having baby teeth is there's space holders for the adult teeth. So if we prematurely lose baby teeth, now that space closes in and now there's no room for that adult tooth. So very frequently in kids, we can look at their dental arches and see kind of the spacing of, you know, either skeletally what things look like or dentally, how much space we have, how close things are or aren't. And that can be a really good indicator of, okay, when the adult teeth come in, are we gonna have room for them? And that's one of the reasons, if you look at pediatric teeth, there's spaces between them because they're of course smaller than their adult successors, right? So if you've got baby teeth that are pretty snug together, then you can even look and kind of say, hey, there's probably not gonna be a lot of room for these adult teeth to come in. So there's definitely different signs and cues that we look for. Typically in adults, it's TMJ and wear facets on teeth and wear patterns. And in children, it's premature loss of teeth and just kind of spacing in general.
Okay, that makes sense. And then following up on that, you mentioned TMJ. Mm-hmm. So I know that there's been some talk with obviously tooth issues can cause TMJ pain and issues with the way that the TMJ, the actual joint itself is functioning, can cause problems with teeth, with wear and cavities and all that. What would you say you notice, or what's one thing, if someone comes in with, they say, I'm having a lot of TMJ pain, what do you look for and what kind of options do you give them?
Yeah, so TMJ pain is really, really, really multifactorial. And what I mean by that is it's very individual. And it can be caused by a lot of different things that sort of just create this perfect storm. So there's dental reasons someone might have TMJ pain, but there's also a lot of just orthopedic reasons that someone might have that. You know, we live in a culture where we're all in this forward head position, right? And it's funny saying this to you because I know you know this stuff like way better than anything I'm gonna say to you, but right, so we're all in this like forward head position and we're all straining all these muscles in our neck and in our back and you know, and that strains in our jaw, right? So it can be postural, it can be the way that dental arches are set up and come together. There's just so much that goes into it. Typically TMJ pain is really one of three things. It's neuropathic, so we have nerves that are maybe misfiring or getting kind of squeezed in certain ways that they shouldn't be. It can be a true jaw joint issue where we have a little fibrous disc in here and that can get displaced, and that can happen pretty easily. Your jaw joints, unlike other joints on your body, they have to move together, right? I can independently move this shoulder. I can't independently move one jaw joint. So that's overcomplicates the system. You've got two joints that have to work together. And in addition to that, each joint is a double joint itself. So you've got this like double jointed situation that's just set up for failure. So we can get displacements and things like that. But then the third, and the one I would say I deal with the most and I see the most, is really myalgia. So it's muscle in origin. We call it TMJ or TMD, and we say that it's, you know, we say it's the jaw joint, but really normally it's most of the time the muscles that are really causing the issue. And so in treating that as a dentist, yes, you have to obviously figure out well, what's causing it for this person, what's the etiology of it, and it's typically multiple different things, right? And then from a dental standpoint, yes, we can make orthopedic appliances, we can, you know, try and better equilibrate the bite or balance the bite better, right? But we typically have to work with other healthcare providers too, you know, for some of the postural issues like chiropractors and massage therapy and acupuncture. Sometimes too, we have to work with counselors and therapists on stress management. Stress is a killer. You know, we've seen with COVID and everybody being stressed out, the amount of TMJ and TMD that we've been seeing is through the roof. And when you're wearing a mask and you have your jaw in kind of this perpetually like open position, right? That does it too. So everybody's, you know, between stress and the face masks, we've been dealing with a lot of that kind of stuff. So it really depends on what's causing it and then how we treat it. But there's a whole array of different ways that we go about doing that.
Right, makes a lot of sense. And it's interesting you kind of bring up the mask, because just thinking to myself, when I have the mask on and when I was wearing it, I just tend to move my mouth differently.
Yeah, you do. Well, and it gets up in your eyes, right? You know, it kind of starts to creep up in your eyes, and you know, try and get it out of your eyes. You're like shifting your jaw around and trying to move it. Or sometimes you don't realize. Sometimes it's putting pressure, and you're actually clenching more so, because it's like, oh, I've got this thing that's pushing on me, and then you kind of realize, and you're like, hey, like, relax, teeth. your teeth are only supposed to touch when you're swallowing, right? So if you're sitting there and your teeth are touching, that's called clenching. People don't realize that. People, there's certain people that you say that to and they're like, what do you mean my teeth aren't supposed to touch? It's like, yeah, you're not supposed to sit there. That's not the natural position of your jaw. Your jaw's supposed to be cradled by those muscles and those ligaments, and it's supposed to be hanging, and there's supposed to be space between your teeth. But the mask, for some people, it just amplifies the fact that you just want to go like this, or move it all around as it gets in your eyes and stuff like that.
So with that, I wanted to kind of circle back to something else, because I know another thing that dentists can provide is, especially when it comes to like grinding teeth, there's some things with that. But I wanted to kind of ask a twofold question on that. First, what options are there for people who grind teeth, especially at night? And let's go back to someone who has one of those like Invisalign. Can they still use those things, or how does that work with those two?
Yeah, so absolutely. So clenchers, grinders can still do clear aligner therapy. There's nothing wrong with doing that. They change the trays every week, so it's not something where they're going to perforate through them and now it's a worthless, appliance or anything like that. With respect to appliances and things that we make, there's different types of guards that we'll make. So typically we call it like a night guard, or an occlusal appliance, something that is custom made for the teeth, that positions the jaw joints in the most orthopedically stable position, and sets their bite up so it's really balanced, and we're not hitting heavy anywhere, we're not triggering muscles to kind of fire in their sleep. Teeth like up and down vertical forces. They do not like getting hit side to side. So without getting like too technical and too geeky, it's one of the reasons that we have those points on our canine teeth, our fang teeth, is because when we move side to side, those teeth are supposed to touch, and it's supposed to make everything else not touch, or disclude is the word that we would use. But because if stuff starts getting hit into in the side, that's where we start getting unusual wear patterns, gum recession, TMJ pain, headaches. It just, somehow the system will figure out what wants to break down, but something in the system will start to break down a little bit. So it's a lot of times appliances. Again, sometimes just stress management is very helpful too, but there are different types of custom appliances. If it's a true jaw joint issue or a disc displacement, what we make is a different type of appliance where we actually position that lower jaw a little bit more forward. And what that does is it stops that little fibrous disc and all the nerve tissues and the retrodiscal tissue and the things back there from getting pinched. So we take the pressure off of it, because that's what hurts somebody, is when things are displaced and not in the right spot. Well, then as you function, you're getting nerves kind of squeezed and things are pinching. So if we can move things forward and take the pressure off of that, the body learns over time to make what we call a pseudo disc, or make something else where that disc used to be. It'll make kind of like scar tissue, and that way you function more on the scar tissue. We're not just pinching all this really vascular tissue that's full of all the nerves that hurts. So it's customized to the person and what the situation is.
That makes perfect sense.
Yeah.
Well, we talked about a lot of different things, and I'm sure we could go and talk even more about everything too. But we'll go ahead and leave it there. But before we end, is there anything else we didn't talk about that you'd want to either recommend for people or make sure that they know?
That's a good question.
How often should they come in to get checked? I guess that's one thing. Is there a specific, is it like every 6 months, once a year, every two, like how often should people get checked?
Yeah, so sadly with healthcare, right, and it's very insurance driven, and in my industry, what that means is insurance tells people, twice a year, go get your teeth cleaned and checked out, right? The reality is there are people that don't need a cleaning and their teeth checked out twice a year, and there's other people that need it more frequently. So it really depends on the individual. Providers really should be, though, communicating that clearly to patients. So there are some patients where I tell them, you don't need me to look in your mouth and tell you that you've got perfect teeth twice a year. I'm happy to look once a year and tell you that you've got perfect teeth, right? And then there's other people where I say, hey, listen, I want to see you back in 3 months and make sure that we're not letting a small thing turn into a bigger thing, right? But it's small enough that I still don't want to treat it now, but knowing your body and how things move in your mouth, I don't want to wait 6 months and now we've, got a root canal or we've got a bigger issue when we could have intervened sooner. And it goes both with cavities and gum disease. Typically, most people, because both are bacterial mediated, right? It's a bacteria that causes both, and it's a different bacteria, right, or group of bacteria. Most people don't have high risk of both problems. Most people, the bacteria in their mouth, it's really one or the other predominates, and they're more at higher risk of that. So someone might only need exams twice a year to check for cavities, but they might need cleanings 4 times a year because they're just more prone to gum disease, they build it up quicker, maybe they don't have straight teeth, so it's harder to clean in there, so even though they're doing a really good job, you just need a professional to kind of get in there and get some of the tight spots, right? So it's really customized to the individual, but that's something that the individual should know, and they should communicate that with their provider, and it should really be custom tailored to, okay, what are my risk factors, how frequently are you recommending that I come in for exams, I come in for cleanings. Same thing with x-rays. Dental x-rays have such a bad stigma because people think that it's insurance driven, or the media has made such a huge ordeal about the radiation, when in reality we use digital x-rays. If you take a flight from LA to New York, you're getting radiated about 15 times more than anything I'm going to do to you, right? Even x-rays, that should be custom tailored to the person too. It's not, okay, every 6 months we're going to take checkup x-rays, or every year even we're going to take checkup x-rays. If you're low risk of getting dental cavities, you don't need them unless, you don't need them more than every 18 to 24 months, right? If you're high risk, you might need them every 6 months. So all those types of recommendations, I would just encourage people to talk to your provider and understand, why something is being recommended the way that it is. So there's really, I'm kind of over talking your answer, but there's really not a clear-cut answer of every single person should go, twice a year for a cleaning and twice for an exam. Yes, that's what the insurance wants to tell you, but is that what's really best for your health? Not for everybody, for some people, but not for everybody.
That makes sense. It's very individualized.
Absolutely.
Well, thank you for having me out here. The office is beautiful.
Thank you.
We're right in downtown Naperville, so it's very easy to get to because we're not necessarily in the heart of downtown, so you don't have to
We
deal
saw
with
the
any of that.
parking, I know.
Yeah, I mean, great parking lot out here.
Yeah.
This is just very easy to find, easy to get to.
Yeah, thank you. I appreciate that. Thanks for coming out. It's been fun chatting with you.
Yeah, and if you guys need anything, we're going to have contact information below. Make sure you get an appointment scheduled, and Dr. Gantos will take care of you.